my passion and love for healthcare kind of grew, because I was around people and that's what I enjoy doing. So that's why I ended up kind of naturally wanting to become a nurse.
I've always had the passion of becoming a nurse, but as a mature student, I just wasn't sure which path to take. So when I got introduced to the Nursing Degree Apprentice, I thought, I've got kids, I've got a mortgage, I've got things that I need to pay for. This gives you the opportunity to study and earn at the same time.
The apprenticeship route is great because you can kind of work all with your lifestyles. You can be the adult or have your family, but at the same time you're developing yourself and developing your skill set so that it can unlock doors for you for the future.
I think nursing is one of those most fulfilling roles out there. It's an art, and the art is in the nuance of someone's not saying that they're in pain, but you can see. So it's those nuances, but it's also a science. It's got the theory and the knowledge behind it. So all we're doing is having that apprentice at the centre of everything we do.
It really sets them up for when they become a qualified nurse, and it opens so many doors for them. And they can then look at roles that actually maybe they might not thought they were ready for, but actually if they can apply all of their experience that they already have in a way that makes sense for them for that role, they can achieve anything.
The structure of the program is over 2 years, and it's divided into 3 modules which span a period of 8 months each. Each of the modules have a placement period. We're presenting things in a way that captures different learning styles.
I like the practical aspect. Going to university and learning the theory and getting the opportunity to apply them in practice is how I learn better.
The apprenticeship route allows people who perhaps wouldn't have been able to go to traditional university at the normal time, but have loads to give and will make fantastic nurses, the opportunity to become a nurse without having to leave a job and go into debt.
Working alongside, being able to still live and have that income come in was really useful. And then what I was learning from being an apprenticeship, I was really able to take that onto the wards or my place of work at the time and kind of mould that into my practice, which was really useful.
It can be really daunting if you're not an academic type of person to come to university. They come with knowledge of skills, and it's up to us to just give them that depth of knowledge, the theory that's behind that.
And I absolutely think that people who go through the Nursing Degree Apprenticeship make fantastic registered nurses because of the combination of the experience that they've already had and also, of course, the learning that they get when they're here at the University of East Anglia on the Nursing Degree Apprenticeship, as well as the experience they get when they're on placement on the NDA.
My manager has been amazing and very supportive. Because I've got children, she had agreed to give me set shift on my workplace so that I can still support my husband and care for the children.
Our apprentices are supported every step of the way. So from the moment that they are applying, they're coming in already before they start. They've got the support starting.
So you're never alone in this nursing degree.
In your apprenticeship, there are so many people there willing to support you. Not only have you got UEA, you've got your workplace, you've got your mentors, you've got your friends, your family.
There are so many people in the hospital going through the same thing as you are.
People that just genuinely care about your well-being, about how the transition goes, and making sure that you achieve what you want to achieve at a professional level.
So we just break that down for them, break down their learning outcomes so that they actually understand what's been asked of them, where they sometimes struggle with the academic side of it, academic writing, critical thinking, and that's where we support them.
It makes you feel like all of those years of practice, everything that you've learned over the years actually has an awful lot of value.
I think it makes them hugely employable, and nearly all of the nursing degree apprentices that I've seen graduate as registered nurses will progress quickly into band 6 and beyond.
Don't be scared to just kind of get involved. Be a voice, absolutely be a voice. Ultimately, opportunities will only come to you if you're willing to seek them and be that voice. Show people what you can do, and don't be scared to stand up for what you believe in, your patients' beliefs, and be an advocate for them.
I think that we're making a difference in our learners' lives because we've mapped all their learning to these proficiencies and duties, we are ensuring that they are ready to be the workforce of the future.